right, good afternoon, everyone, and welcome to the American Head and Neck Society and Head and Neck Cancer Alliance webinar on preparing and enjoying foods for head and neck cancer patients and survivors during the holidays. My name is Heather Starmer, and I am a clinical associate professor in the Department of Otolaryngology, Head and Neck Surgery at Stanford University, and the director of the Head and Neck Speech and Swallowing Rehabilitation Center at the Stanford Cancer Center. And it is my pleasure to be moderating today's webinar. I would like to thank all of our presenters today, including our Head and Neck Cancer Ambassador, Ellen Sheffer, as well as Lisa Maccaroni, Lisa Blumenfeld, and Rachel Sachs for taking part in this webinar discussion. For today's webinar, our presenters will offer their comments for the first half of the webinar, and then we will open up for questions and answers. Feel free to ask questions as they come up through the question and answer section or by the chat function. To begin with, I would like to introduce our first speaker, Ellen Sheffer, who is one of the newest Head and Neck Cancer Alliance's ambassadors. She is an educator and administrator with the San Luis Obispo County Office of Education. She is a survivor of HPV-attributed oropharyngeal cancer and loves to cook and is an accomplished baker. Since her treatments, she has had an extremely limited diet and looks to share some of her tips and knowledge with head and neck cancer patients and survivors and how to navigate through the upcoming holiday season. Thank you so much, Ellen, and I will turn it over to you.
Thank you, Heather. And I am really excited about this opportunity today. It's my first time doing this, and I'm very grateful to HCNA for including me. Like many of you, I believe, who participate in events like this, I'm a social person, very much enjoy being around colleagues, friends, families, and strangers who may become friends. It's just part of who I've always been. So I've had to learn to navigate since my cancer and treatment, things having to do with change in taste and xerostomia, severe dry mouth, as well as some mild dysphagia difficulties. So my diet has changed quite a bit, but I still enjoy cooking a lot. I enjoy baking. It's kind of what I do. I'm not very crafty. I can't draw a straight line, but I have always cooked for friends and family. So I still do that. Some things that have changed for me are I need a taster now. I can't taste, I can't sample many of the things I cook because I'm unable to. Many foods are now taste offensive to me. So I can't enjoy any spice. I just have a very unusual diet, as I know many of you do as well, for various reasons. So one of the things that when I think of with socializing around the holidays is keeping the emphasis on the joy of being with the people. The emphasis is on socializing for me and less on the food and drink that is available. So I think of holidays socializing kind of in levels. So the first level for me has to do with people I know well, family, close friends. So they're happy to accommodate me. They know they've been with me through this journey. They're aware of the challenges I face. And so that's not a big problem. The next level has to do with maybe business parties, more a step up in terms of formality. And those have some of those issues I deal with. For example, if it's going to be at a restaurant, I will always look at the menu before attending. If it's a sit-down dinner, I may talk to the host if it feels like it's an appropriate thing I can do. And ask some questions. And then I have to make a decision. Will I eat before I attend? Will I eat at the event, if possible? Will I eat upon returning home? Or just how to manage some of that. again, keeping in mind that the event for me has to do with the socializing or the conference. I'll be attending a conference in early December, and some of that will have to, and it's 3 days, lots of meals, and I'll kind of wing it as I go. I tell myself and I tell other people I can usually find something, and if not, then I'll manage. I will carry something with me. Something I like doing at parties is I drink a lot of water. I particularly drink warm water. It works better on my throat. And I will have water in a wine glass or in a cocktail glass. So at least it appears that I'm, participating. And I feel that I'm participating in some way. If it's a party with hors d'oeuvres or something, I'll put something on a plate or a napkin, even if I won't be able to eat it, just so that it appears that I'm, part of the group. I think, as with many of you, I know I've learned how to manage my diet. I've learned what I need. I remind myself again that the reason for attending is to socialize. I do have a short response to questions about why I'm not eating or drinking alcohol, because I don't usually want to turn the conversation into one being about cancer or me, unless people are really interested and have specific questions. And I think a little something I've learned to be pretty good at is advocating for myself in terms of I've learned how to take care of myself in my diet. When someone tells me what I should be eating, or have you tried this? I still get a lot of that. Have you tried this? So I think to keep the conversations on track to a more social level is important as well. And sometimes I just have to know that I may not eat. I may go to an event and not be able to find anything and not have that ruin the evening for me. When it comes to hosting parties, which I love to do, I have learned a few tricks so that I'm able to at least prepare a few things for myself that may look the same as what everyone else is eating. So I can make something with no spice at all. I have a few recipes that people seem to enjoy, that we can, corn pudding, that for my share of it, I put it in a blender and still bake it. It looks the same, but it doesn't have, it's a little easier for me to eat. Macaroni, most recipes can be adjusted. If it says add salt, if it's not something you're baking, I don't add salt. I put condiments at the table. I put salt and pepper at the table. And that way I'm not purposely excluding myself from my ability to eat. So I hope that's helpful. I know a lot of the slides and people coming after me are discussing some of this in more detail. Again, feel free to put questions in the Q&A or the chat. And as others are speaking, I'll get to those. So thank you again. This is a great honor for me to be participating in this event.
Thank you so much, Ellen. I think you really highlighted the point of, focusing on the purpose for the gathering, and particularly when eating is so challenging. I think it's so important to keep in mind that the people want you there because they want you there, not because they want to watch you eat. So I think that's a lovely way to think about it. I would like to now introduce our next speaker, Ms. Lisa Blumenfeld. She is a medical speech-language pathologist serving patients with complex swallowing disorders and communication disorders for over 25 years. She's a board-certified specialist in swallowing and swallowing disorders and an adjunct professor in the Department of Communicative Disorders at San Diego State University. In addition, she's the founder and co-owner of Endo Education, which provides clinical training and mentorship in clinical endoscopy for the diagnosis and treatment of voice and swallowing disorders. Her current role is as co-director of the Hannah and Mark Lieberman Head and Neck Cancer Center at the UC San Diego Moores Cancer Center. Take it away, Lisa.
Such a pleasure to be here. I'm really humbled to be a part of this. So today we're going to talk a little bit more about dysphagia. Unfortunately, it is a unique entity that carries significant burden and unfortunately is highly prevalent in this distinct population. So of the over 500,000 people that will be diagnosed worldwide with this condition, it's been reported to be present in more than 64% of patients as having a bona fide swallowing issue. Now, it's really important that dysphagia is an entity. It's something that patients are diagnosed with, and everybody on this call, in this forum, understands this. But yet there are tentacles that sort of emerge from this diagnosis, which interface with very specific parameters of quality of life and clinical outcomes. Patients can be unable to safely swallow, which can develop into an aspiration event or aspiration pneumonia. It can also lead to acute or chronic complications in getting food and liquid in, causing malnutrition and dehydration, and in some instances can be severe where a feeding tube is required. So we speech pathologists, we have a very heavy burden ourselves, and that's to try to wrap our arms around this beast, which is dysphagia, to diagnose it, and then to prescribe recommendations that are there to keep patients safe. And that can involve changing and modifying the texture of foods that people eat. It can modify the way that they do eat. So having to use specific textures and strategies that make eating possible. And in some cases, it's taking food off the table completely. Go to the next slide. Now, I, as a speech pathologist, I'm sure Heather will agree with me, we're always checking ourselves to remember that the burden on us, the gravity of these recommendations is enormous. And we have to always think of that. And that is really because food is a true conduit in how people experience life. Food isn't just a thing. Swallowing isn't just an activity. It's where food and culture and experience intersect. And so this wonderful article by Belinda Kenny illustrated this beautifully, and how food and the act of eating and can help provide us with our own unique identity and who we are. And we just heard that from Ellen, really enjoying cooking and baking. And it also links us to community. It links us to people. It can help define who we are as a religious group, as a cultural group, and it marks opportunities to share joy and to be happy. And therefore, when there's this dramatic disconnect in our ability to connect because of our dysphagia, our inability to eat, this can cause enormous conflict. You can go to the next one. So I'm a big believer that as speech pathologists, we always have to think about creating a balance. Our recommendation should never be unilateral, that we just come up with what is best for our patients. Our patients have to be involved in what is best for our patients. And that means putting together a group that involves ourselves, it involves our dietitians, all of our ancillary providers, and our patient at the center. Because only through shared decision-making can we come up with something that both we can live with and our patients can live with. And so that's sort of the method that I use to sort of create, like I said, that balance. And nowhere is this more important than during the holidays when we're specifically thinking about modifying what patients can eat or if they can eat at all. This brings us to the topic of texture. And this is really where we're trying to figure out how do we make texture work with the holidays. But first we have to define texture. And so for many years early in my career, there was no standard way to do that. And I wanted to just highlight this lovely program. This was a global initiative that was designed to create a connection between the dots across providers across the world. And so this IDDSI is a method to standardize texture recommendations for foods and for liquids all over the world. And this allows us all to speak the same language, so that this diet is conveyed accurately to our colleagues and to our patients, and then they understand exactly what they need to eat. So it's a 8-level system that really quantifies both food and liquid textures. And you can see they're sort of inverted pyramids. And so the wider ends of those pyramids are looser guidelines, free, normal textured foods, regular liquids. And as we go to more of the pointed side of that pyramid, this becomes more restricted, going from liquidized foods to extremely thick foods. Compliance is a big issue for all of us in head and neck cancer. And I think, again, it goes back to that notion of keeping our patients sort of at the center, so they're engaged, they're educated, they understand exactly not what they need to do, but why. I think that's a big part of it. But as a whole, if we look at investigations of patient adherence, sometimes it's not great. And I think there's a lot of factors, especially when it comes to diet texture compliance, that are important and in play that we need to think about. The first is, do we have patients and caregiver? Do we have family caregivers that can provide support? Do patients have the financial resources to purchase specified foods and the equipment that is needed to modify these textures? We need to think about that. Can patients cook? Can they prepare it? Do they understand how to use these devices? And then this is definitely something we don't think about, again, as providers. How do we think about making that transition from our little clinic room to a kitchen so that patients can employ these things? And so just want to quickly highlight, going to the next slide, a program that we initiated. And this, we created our own sort of kitchen space. It doesn't need to be this fancy. It doesn't need to be this big, but we basically have a kitchen space where we have different types of equipment and different types of food, so that we can take our recommendations, bring our patients there, and really highlight what they need to do and how they need to do it, which is consistent with their IDDSI levels. And so this is a lovely example of how we sort of go through textures. We'll go ahead and pull their IDDSI and then start experimenting with foods and provide many strategies that really help with reproducibility and convenience. So this is an example of preparing foods and using molds so that they can be frozen and then actually popped out and reheated. And actually, by freezing, you actually incorporate more moisture because of those ice particles that adhere to the food. So very nicely reheatable. Modifying texture is key, and having the equipment to do it is really important. This is one of my most favorite products. It's an immersion blender. Oftentimes these blenders come with different attachments, which will really allow a very easy, efficient, and cost-effective way to prepare just about any IDDSI texture. And taking foods that are enjoyable without necessarily having to open up cans of baby food, but taking foods that we appreciate, we like, and transforming them into something we can swallow. And standardization is key. So with our training also comes techniques and helping our patients better understand how to test and see that they are actually creating the right texture. So there's a set methodology by using syringes and basically taking into account in a very simple, easy way, how does food fall off a spoon? How do liquids flow through a syringe? And so patients then will be able to really understand what are these levels and how can I make sure I'm doing them correctly at home. And last, and this is where we get to play around with the holidays. So it's really taking foods that these patients love and enjoy and finding a way to make it work. So these are just two examples of things we played around with a couple of our patients last week, sweet potatoes and turkey. So this was a wonderful way that we took good old-fashioned sweet potatoes. Some of our patients that could have a slightly higher texture, we used pre-cubed potatoes. And then if we really needed a softer texture, we used canned yams. We use a lot of aromatics, and that's for folks with dysgeusia and ways to sort of elevate the sense of smell to make it more palatable. And then on the other side, turkey. There are some wonderful products out there. Regular turkey is oftentimes a difficult texture to eat safely and efficiently. Canned turkey can be great. And this is one example of how we use canned turkey. It sort of bathes in its own juice. We reserve the juice so that then we can add it and make it as palatable as we can, and ultimately allow patients to feel like they're at the table, they're part of that meal, they're enjoying these holiday foods, and they're doing so safely.
Thank you so much, Lisa. Really, really great tips on how to work around textural challenges that many patients are facing. It's now my pleasure to introduce Lisa Macaroni, a registered dietitian nutritionist who has been with the Hendricks Regional Health in Danville, Indiana since 2006. In addition to her duties as a clinical manager, she counsels oncology patients and is the facilitator of the Avon, Indiana chapter of the Support for People with Oral Head and Neck Cancer support group. Lisa has served as an expert reviewer for nutrition and head and neck cancer materials for the cancer support community. Thank you so much, Lisa. Look forward to hearing what you have to say.
I want to tag on with everyone else. This is a great opportunity to reach a lot of you guys. I know there are pockets, I was saying earlier, in the United States where you may not have access to specialists. I had a gentleman call me one time that was remotely in another state and, was misinformed. He said, I thought when radiation and chemo were done for head and neck that I would be able to taste and eat normally again within weeks. And, it's heartbreaking to get that because we know that's a very different situation. So today we're just going to talk about kind of what I would field in my support group getting ready for the holidays. And it tags a lot off of what Ellen had spoke about. So really, if you are in a house and you're hosting Christmas or Thanksgiving dinners, and you have a head and neck cancer survivor attending your party, it's nice if you can reach out to that individual before the event. I think Ellen talked, if you're close friends, it's easy. But even if say it's a cousin that you haven't seen with COVID in 18 months and all this has happened to them and you're really unsure of what they can tolerate and what they can't, don't hesitate to make that phone call and reach out. Ask questions. Don't feel, I think as a survivor, we don't want to see someone who's hosting a party turn the party upside down to accommodate everything. But at the same time, if there's going to be a handful of foods that you can tolerate there, that's very helpful. The other thing is if you're asked to bring something to the meal, bring something you can eat. I think a go-to at this time of the year for a lot of patients is like a butternut soup, squash puree. And back to the IDDSI information that Lisa shared, those mixed textures in a soup or in a stew can be really hard to handle. So that's where using something like an immersion blender is great to puree any favorite soup that you might have out so that the consistency is the same. And feel free to take it to share with others, but then you at least know, hey, there's soup here that I can eat. The other thing when you are going to a house and you're not sure what you're going to have, even mention to the host, if you can put a carafe of water on the table close to where I'm going to be sitting. We all know how important water is through that meal to help wash things down. And also make sure that you're staying fairly focused on eating when it's time to eat so that you're not distracted and accidentally swallow something the wrong direction. We know when head and neck patients are starting to really eat again and get that confidence that it takes a lot of focused attention. And the other thing I get a lot is the time factor that it takes to eat. It takes y'all a lot longer to eat a meal than it ever had. So just knowing, expectations of you at a party. I loved Ellen's tricks that she's had. I think there's nothing better than talking to other survivors about what tricks they've used. I thought hers were excellent. And it is, I have patients that, are ranging from I have a tracheostomy and I cannot take anything orally and I have a PEG tube. And I know I've seen in the chat box, there's PEG tube patients out there listening today, all the way up to maybe you're 10 to 15 years out of treatment and you're doing pretty good. If you have a PEG tube, decide before you go, am I going to go ahead and give my feedings before I go to the party? Or is this close family and I can prop myself up in a lazy boy close to the dining room table and give myself a feeding while everybody else is eating, but still participate socially? And I loved what Ellen said, make it the focus that it is social. You're out to talk and engage with people again. Food in the United States, and I'm sure in other countries, my last name's Macaroni, so what I married into is the Italians, but very focused on food. And with head and neck cancer, it definitely really makes that very much, you feel that focus and feel a little left out at times. So just encourage, if you're hosting, take the focus off the meal. Some things that are really easy to do, make it a buffet so that people are not sitting down and passing foods. Make it something where maybe it's an open house at Christmas where people are more coming and going. Food isn't the focus. Instead of having this lovely, huge display of food, maybe it's less food, or, it's not the focus, but you have this fabulous display of old photographs from a family, that people can sit down around a table and be like, oh, this is what it was like in 1950 at Christmas at mom and dad's that year. And, you know, focus around those things instead of food. All in all with this, I think if you're hosting and you're expecting a survivor to come and they're a little hesitant, just really reinforce, hey, this isn't going to be the same if you're not there. We don't mind, you know, whatever challenges you have, we're going to help you through this. And we just really want you to be there to participate. So going on to the next slide, if you're hosting a meal, that's a whole nother issue. And especially if you're the survivor and you're not very far out of treatment, make it as easy as possible. Make it a potluck. If you have kids, adult children, kids at home, grandkids, and they want to ask how they can help, this is where coming in and setting up tables and chairs before and making sure you have a cleanup committee afterwards, that you're not overexerting yourself. I don't think anyone wants to come to a home where they know some of the family has had some challenges with illness and feel like that host really overdid it and got themselves into some trouble because they've hosted this get together. And also you can talk about it. Maybe you go out to dinner instead. Maybe that's something that's an option. But just keeping realistic expectations is super important. I think I've seen in the past, my experience, some families get so wrapped up in traditions and I'm gonna make this or I'm gonna do this no matter what, even though I've been through 7 weeks of chemo and radiation in the last, you know, and it's only 2 months out. I think what comes down to, and give yourself a little bit of grace in this, family just wants to get together. If you all are just somehow making something simple, so be it, but just get together and enjoy each other during this time. And for my last slide, I think, yes, and this is just some of the tricks I think you all have probably learned along the way. You know, faced with this meal of some foods that you know you're comfortable with, but a lot of things that you're like, whoa, I don't know. You know, right off the bat, and avoid the sharp, jagged things, chips, you know, bread and big wads of meat that is dry is not the easiest things to swallow. I hope you've, you know, managed this by now. Gravy is a beautiful thing to pour over a lot of stuff and mash things on your plate. Try little bits, take your time, and just really enjoy the conversation. If you have supplements that you use, take those with you. Make sure you have water along with and medications for the day. And just really enjoy the time with your family and getting to see everybody again. So I think that wraps up my section.
Thank you so much, Lisa. All right, our last but not least speaker today is Rachel Sachs. Rachel is the Senior Director of Education with the Cancer Support Community, where she collaborates with and supervises the education team to create and implement relevant education and outreach programs to patients, families, and caregivers affected by cancer. Prior to joining the Cancer Support Community, Rachel was the Director of Cancer Services at Doylestown Hospital, a community hospital located in Doylestown, Pennsylvania. In this role, Rachel led a team of oncology professionals in providing comprehensive treatment, navigation, and support services to cancer patients and their families. Thank you so much for joining us today, Rachel.
Thank you, Heather. It's a pleasure to be here. So as everybody knows, around the holidays for everybody, it's a stressful time. You're seeing family who you haven't seen in a while, getting presents, hoping that your loved ones like those presents, spending time with family members who you might not have seen for some time, and it's stressful. And people are just coming together. Put on top of that a medical diagnosis that you're dealing with, and it just intensifies the level of stress around the holidays. Holidays can be wonderful, but we can't take for granted that there is stress. So when you're dealing with a medical diagnosis, it's very common, and you should feel okay about experiencing the following feelings. A concern if you'll be physically strong enough to participate in the festivities. Do you feel strong enough to come to the dinner table? Do you want to take a step back? Do you feel that you might have to leave early? Uneasiness if you feel or look different than the last time that you saw family and friends. With COVID, lots of us haven't seen family and friends for a long time, or we've seen each other in Zoom. Have you lost weight? Do you look fatigued? Is there coloring different? And how do you explain that? And do you need to explain that? And we don't want that to make you feel uncomfortable. pressure to perform holiday rituals when you're not feeling emotionally invested, whether that's eating, like we've talked about, singing, just coming to the dinner table, opening gifts. Are you really feeling up to doing those types of things with one another or not? And lastly, uncertainty about the future when you're with your family and friends who are celebrating the new year. We ring in the new year together saying we wish this and we wish that. And when you're experiencing a medical diagnosis, you're really in the moment. Sometimes you're not thinking about what does tomorrow hold, what does 6 months hold from now. And that's acceptable and that's okay. Next slide, please. So strategies that we recommend that you use during the holidays. First of all, focus on your own physical and emotional well-being. So really just center around yourself. Of course, you want to be concerned about other people, but really right now you focus on you. Are you feeling up to coming? Or do you need to navigate about, you know what, dinner's called for 3, but maybe I'll come at 5, or maybe I'll come at 3 and I'll leave a little bit early. That's okay. And focus on, how you're feeling. And if you're feeling more quiet, don't force yourself to say, I need to talk to everybody. Feel comfortable saying no. That's often hard for all of us, regardless of what it is. If we're in a work situation, we're in a family situation, particularly around the holidays. But for all of us, it's okay to say no. And particularly if we're dealing with a medical diagnosis and we're not feeling well physically or emotionally, it's okay to say no. Maybe you should think about how we say no, but it's certainly okay to say no. Plan ahead, like many of the other speakers talked about. Think about, okay, how am I going to navigate what's at the dinner table? Talk to your host, or if you're hosting, think about that beforehand. Think about your timing and have a plan in your mind about, I think I'm going to leave at this time, but if you're feeling better, then you can accommodate that. But if you have a set plan in place, it often gives you a level of structure that you can then become flexible on, versus coming in and feeling a level of anxiety if you don't have that plan. Do things that make you feel calm and relaxed. So maybe that's when you're driving there, listening to calm music. Maybe you do breathing exercises. Taking a step outside for a few minutes with a close family member or even yourself, just to take a breather. That is completely acceptable. We all do that, even if we don't have a medical diagnosis that we're dealing with. So it's okay for us to do that. Know things that are going to be different, but try to embrace the moment. So things are so different for all of us right now due to the experience that we've been dealing with for the past couple years. And when we're dealing with a diagnosis like head and neck cancer, things are going to be different. But embrace what's in front of you. Embrace those loved ones that you haven't seen. Maybe you can't embrace the entire experience, but embrace and think about just some specific moments and be in the moment. And prepare for questions. Many of us talked about earlier about preparing for questions. So think about some of the things that people or family or friends that haven't seen you might be asking you, and also know and feel comfortable that it's saying, you know what, I don't feel comfortable answering that right now, or let me get back to you about that, or let's talk about that a little bit later when I feel more comfortable one-on-one. Next slide, please. So some more strategies. Celebrate your strengths that you have developed. Create new traditions and memories. So maybe this holiday season will not be exactly how you remember former holidays being, but that's simply okay. Each holiday is different. And know that the traditions and memories that you're forming with your family members will be special regardless of what's going on. Be honest with your loved ones about your feelings. So if you're not feeling comfortable about being there the entire time, or you're feeling self-conscious, or you're feeling that you can't participate in all of the items in the meal, be honest with your loved ones and just say, you know what, not right now, or I'm not feeling up to it. And I know that they will respect that. And seek the support and advice of your healthcare team. Never, never, never feel bashful about before the holidays, during the holidays, after the holidays, reaching out to your physician, your nurse practitioner, your dietitian, your social worker about how do I deal with these particular types of questions? Or afterwards, this made me feel uncomfortable. How would you recommend the next time that I approach this situation? Next slide, please. And for you, cancer support community, we have many resources for patients who are dealing with head and neck cancer. So please don't hesitate to reach our website and or call our helpline, which social workers, licensed social workers are available to you Monday through Saturday and can assist you with some of your concerns and or direct you to other resources to help you. Thank you.
Fantastic. Thank you so much, Rachel. What we're going to do now is transition over to our question and answer. I welcome anybody to enter their questions either in the chat or the question and answer box. And if you have a question that you'd like to ask verbally, you can use the raise your hand function and we'll have the co-host call on you and allow you to ask your question live. So we'll start off with a couple of the questions in the question and answer. Such great ideas. Going out to eat, to be with friends and family is very difficult. It's not always possible to find something to eat from the menu. Anybody have some comments on that?
I do. It is difficult. You know, you go to these restaurants and there's like a 4-page menu and you think, wow, okay. What we've done in the past, we've had some events out at restaurants for our survivor group. I will call and ask if there can be a pureed soup available that night. We get water. It's limited. So a lot of times just knowing that, you know, maybe you eat what's safe at home before you get ready to leave, and then maybe just having something small or just even a drink. But you just, again, I think Ellen said it so well, focus that it's on that social aspect of the evening. Some restaurants, if you go to something that is not a chain, they may be a little bit more accommodating to you too.
Yeah, I was going to jump on that and say a lot of restaurants are wonderful about modifying their preparation, and I would definitely avoid restaurants that we know are going to be problematic. So there's certainly different cuisines that are extremely spicy, or there just aren't as many ways to modify texture. So I think being thoughtful about where you're going and maybe even calling ahead to see if any accommodations can be made, I think oftentimes we'll end up with some greater success.
Excellent. There was a question that Ellen answered in the Q&A, but I think it's a very valuable question and answer. So I'm going to have you answer this live as well. The question was, for a Thanksgiving meal, I will be with people who do not know about my dysphagia or my HPV cancer. I will do my best to have a small portion, but invariably there will be a question or concern, why such a small portion or why I'm eating very slowly. Can you provide more details or situations that you were able to get through?
Is that for me? Right. I think that there are a few things to try. One is to just indicate if you're comfortable sharing your situation with people, to do so in a very simple way. I'm recovering from cancer treatment, and this is what works for me right now. And then just leave it if that's possible. Also to indicate that you're just comfortable with small portions, if you can do that. And I know that people, I try and believe and do believe that most people are very well intentioned. Some people are just curious, you know, they're just going to throw something out there and maybe really taken aback with the answer. And that's kind of on them. You know, that says more about them than it does about you. So I think your comfort level in what you are willing to say and feel comfortable saying. But I know when I was undergoing treatment and for quite some time after, I ate very small portions. I had lost a lot of weight, and it was just easier for me to say, this is what I'm comfortable doing. This is what I'm comfortable eating. And if people ask more questions than that, I would respond. With regard to if you're at a restaurant, I think I indicated I will usually try and look at the menu ahead of time and see what I might be able to eat. I will also still frequently order off the children's menu. I don't eat a lot at one time. I just am unable to do that. So, and often because of some of my personal limitations with spice and taste, I find that things on the children's menu, generally, they don't add a lot. They're not highly seasoned. So those are a couple of things that I do that are helpful. The other thing I do, because of issues with taste and some with texture, are that I will generally, if available, have someone who knows my situation be my taster. And that person has learned to very sotto voice say, don't eat that, or I think this what we call it, what works for me. I think the mashed potatoes will work for you, or don't eat the sauce on the meat or something. So that is also, it's just having that small group of people when possible who understand the situation and respect it. I mean, I've had people say, oh, you can try this, it has hardly any seasoning. And I just say, well, that it won't, thank you, but that won't work. So it's learning your comfort level. And I think that changes over time as you become more accustomed to your own body and the changes that have occurred and respecting that. So I hope that helps. I think that was kind of a general response, but I hope it's useful.
Wonderful, thank you. My next question will go to Rachel. Rachel, there have been a couple of comments in the chat about individuals who are totally feeding tube dependent, and how do they navigate the holidays in those situations? Do you have any suggestions?
Right. So I think a couple of the speakers mentioned it, whether or not you take a seat that's perhaps, if you feel comfortable being near the table or away from the table, depending upon what you feel comfortable with. If you're at your home, obviously you know how to navigate around your own home. If you're at a host home, you can actually, and I would recommend reaching out to the host beforehand and say, I'm on this feeding schedule. Do you have a place and would your other guests feel comfortable at the table if I do a feeding there, or do you have a seat off to the side, and something of that nature. But again, I think what I would totally recommend is plan ahead, think ahead, and figure out what's going to work for you, because it is about you and making you feel comfortable. And sometimes that involves, how am I going to feel comfortable around the guests? So I would just really recommend planning ahead, creating yourself some structure, and reaching out to the host, or obviously if you're hosting it, then you know what your accommodations need to be. And then also give yourself the leeway to know that it's okay to be flexible and for that plan to change. And if you just get a sense when you're there that you need to do a feeding and you're just not comfortable, then feel free to say, you know what, thank you so much for having me. It's been wonderful. Not feeling great right now. I'll see you in a little bit, and go home or do something of that nature, and feel okay that it's okay if your plan has changed.
Fantastic, thank you. Lisa, can you talk a little bit about what you've learned through your kitchen about what tools might be helpful for individuals? Somebody brought up the question of what's the best kind of blender to use. What have you learned there?
So there are some wonderful tools that are available. I think I mentioned I'm a huge fan of immersion blenders. And there are Costco, I know right now, happens to have a wonderful set, at least here in California, that actually has a couple different attachments. It has like a food processor attachment, and it has the grinder attachment. So they're wonderful. And the nice thing about it is that you don't have to transfer things to different devices. So very simple to use, very easy to use. I know that resources can be hard sometimes. Here at our cancer center, we also have shaker cups. which can be really nice if you need to thicken liquids. So they're basically just cups that have a little metal device inside of them. You kind of put in the thickener, you add the liquid, you kind of cover it, and you give it a good shake, and it's going to help provide the right level of thickness without it being clumpy and messy. You don't need a Vitamix, a $400 blender, in order to do these things. You really don't. There are, again, I saw at Costco, $57 for a Ninja. But these are the tools that will allow you to transform foods that you like, and of course, all based and prescribed by your team, but that will allow you to transform foods. And they can, we do all the tasting. So these foods taste delicious, and they are compliant with the IDDSI recommendations. So those are some of my favorites.
Great, thank you, Lisa. Over to the other Lisa, do you have any suggestions from a nutrition perspective about fortifying holiday treats, trying to get the best bang for your buck there?
Fortifying treats. I think, you always look at, is there any dairy involved in the recipe, first of all? And then if you really want to have the highest calorie, use cream, of course. Whole milk works great. There's all kinds of variety of different milks you can use now, including any supplements out there. So your Boost, Ensure, Orgain, there's 1,000 of those anymore too. So it really is trying to decide, what do I want to do treat-wise, and even in your cooking. Just adding powdered dry milk at times to things can reinforce and double protein in milk. But just looking at things that way, adding nut butters into different items when you can also is a good way to add more protein and add calories.
On a somewhat related note, a couple of questions have just come in about liquid vitamins, and where would you recommend people buy liquid vitamins, and what kinds of liquid vitamins might be recommended?
That I usually will send back over towards our physician or pharmacy to recommend for those that are best suited. And it depends. When you're in treatment, we usually pull everyone off of vitamins at that point. It also has a dependence if you're using any Ensure or Boost on a regular basis, how much of that are you using? Because that could provide 100% of the RDA and vitamins and minerals, and you don't need additional vitamins. So I think going back to your medical team, having them look at that and make recommendations from there is your best bet.
Fantastic. Ellen, back to you. You mentioned a little bit about fluids, and of course, perfect timing, you just take a sip of water. Can you talk a little bit about strategies you have found helpful when you're not at home and you need to have those extra fluids while you're eating?
I always ask for water, no ice, no lemon. I can't tolerate cold very well, or at all. And I will generally ask at a restaurant, I'll request hot water, no lemon, just a cup of hot water. And if it's a restaurant that does it, if they could bring it in what they will generally use the hot water, those little teapots. Because I drink a lot of water and I drink a lot of hot water. So I have to do, in my work, I have to do a lot of run meetings, and some of them are very long. I'm the favorite job that anyone would want to have these days. I am a member of a school board. So I will have lengthy meetings, and I will just have either warm water. I will bring a thermos of hot water if I need to. If I'm at somebody's home, I'll just ask for hot water. I'll heat it in a microwave if I need to. I'll do whatever I need to do. But at restaurants, I will usually ask for a glass of hot water or just a glass of water with no ice. If I'm someplace where they have bottles of water, I'll ask for, so when I travel, I was in an airport recently, couldn't take my own water with me. Went to one of the little airport shops, and they had it, of course, in the refrigerated case. And I just asked, I need a bottle of water that hasn't been in the cooler. And even if they have to go find it for me, it's important enough that that's what I need to do. And I'll buy 2 at a time or something. So I think it's just figuring out how much you need and how to make it work. But restaurants, hot water, visiting people, hot water. And again, even in a wine glass or something, at least room temperature water, so I can, raise a toast or feel that I'm part of the group.
Lovely, thank you. Rachel, coming back to you, there was a question that came up a bit earlier about people's comfort level in gathering in the context of COVID and some of the anxieties that come around the fact that we have all been isolated for so long, and some of these individuals may have gone through their cancer treatment during the pandemic. Can you talk a little bit about coping with those concerns and fears?
Sure. I think that they're valid for all of us. I think this is very, very normal, and it's caused a lot of people anxiety. And right now we probably have gone through at least two, this is probably our second set of holidays, and things look different. And depending upon where you're living, things look different. Your county, your town, the state that you're in. First, what I would absolutely recommend that you do is consult with your healthcare team. Should you be congregating with other people? Is it safe for you? Depending upon what treatment you're currently getting, whether it's chemotherapy, radiation, whether you're not getting treatment, and what stage you're at and where you're at in your cycles or your treatment process. That's the first and foremost. Second, let's say that your physician says, from a medical perspective, it's absolutely fine, but it's up to you. So you have to really kind of assess what makes me feel comfortable going in a large setting. You should feel comfortable. I think at any point, all of us, but particularly if we have a medical diagnosis, should feel comfortable saying to our host, can you check if everybody's vaccinated? You can also say to your host, or if it's at your house, you can obviously feel comfortable asking people to get tested before that they come. Or if you're not comfortable with any of that, or you're just comfortable with a small group setting, you can say, you know what, can I come early and spend time with just, you, and let's say it's your son and daughter-in-law, and then maybe leave once the bigger group is coming. But just know, consult your physician, first of all, from a medical perspective, and then just really think about what's going to cause the least anxiety for you. And if it's a big gathering one day, and then you say to your family or friends, I'm just not comfortable. The next day, can we just get together? Or how about you guys come to my house in a few days? Anything really goes. So just really think about where you're at, how it feels to you, and what's going to make you feel the safest and most comfortable.
Fantastic, thank you. Lisa, another question for you about Itsy. The question is it usual practice in the US to educate patients about Itsy? I found this myself and was never told about it. It really is set up for practitioners, but can easily be applied to individuals at home. I'm surprised it's not used more, educating patients and carers.
I totally agree. And in full disclosure, I became proficient with Itsy only about a year, I'd say a year ago. And up until then, we were using all different types of terms. So to answer your question, yes, I think that providers are slowly starting to transition. And also, if you notice and you look at different products, especially ones that are nutritional supplements, a lot of them actually have the Itsy number, the viscosity number on the box or the container. I would go back to your provider, hopefully a speech pathologist or a dietitian, and see if that can be translated to you. And I get in my presentation, we're very lucky we have this kitchen, but that can be done in a clinic, in a small area, even in the clinic room. But I would go back to your provider and try to gauge, be specific of what that recommendation is. It'll be very helpful for that person to know that they need to become compliant. And I think slowly and gradually it'll make its way and spread. I think we're all embracing it and all recognizing it's a really great thing.
I was going to tag on and agree. Itsy is something we adopted about a year ago, and it was a lot of testing to come through to this point. And I think as a head and neck survivor or a current patient, it's great. You really need to question your team. If you've not met with a speech language pathologist and the dietitian, they should be working together to work with you if you have any swallowing difficulty, for sure.
But kudos to you for doing that research on your own and really trying to own your better understanding the texture of diet that works for you.
Great. Lisa, while you're on, there have been some questions about weight gain and challenges gaining weight shortly after treatment. Can you talk a little bit about realistic expectations about that?
This is so interesting. I have a patient that I just talked to this afternoon that has been out of treatment since 2017. So we're going on 4 years. Her calories that she needs per kilogram that she weighs right now to maintain her weight is 46 calories per kilo. So you're talking about a 133-pound lady that needs almost 2,900 calories a day. Head and neck cancer treatment and recuperation and everything, we're seeing your calorie needs are huge. So if you feel like you're losing weight, but my gosh, I'm eating what I used to, or maybe more, unfortunately, the message is you probably have higher calorie needs now. Some of it initially after treatment ends, for that first, I think, entire year, you're looking at having high calorie needs for your body to repair. So sometimes it's jumping ahead and you need 500 extra calories a day. That is where still really relying on those high calorie supplements to supplement a regular diet is important, because it's a balancing act of saying, okay, I know if I drink 3 whatever pluses a day and I'm eating 3 meals a day and my weight is stable, the goal is to try to up your intake of regular food to decrease that supplement. But it requires you weighing in weekly, if not daily, and keeping track of weight so that you're staying stable in that time. It's not easy. Just know that. I think that's helpful for everybody to know. But I think with surveillance, talking back to the dietitian, if you had one at your cancer center, is important. And just gauging that and knowing, okay, what's 350 calories worth of food looks like, here's my supplement, and then trying to make that trade-off as you gradually increase the amount of regular foods that you're consuming. I hope that helps.
That's great. Other Lisa, can you explain Itsy a little bit in more detail? There are a few people who are asking questions about that.
Yeah, I see it. So it is the International Dysphagia Standardization Initiative, Dysphagia Diet Standardization Initiative. Again, it is a global initiative. And I've been hearing about Itsy for years and years. And frankly, I just didn't have the mental space to really adopt it, because it takes a lot. If you're going to start utilizing that, then you have to make a pledge throughout all levels of your organization that you're going to be using that. And I think that's where there's a challenge. I'm also very grateful that I work in an institution where the dietitian and myself work together. So we are able to take these IDDSI and then translate it into something that is very meaningful to patients. So again, IDDSI is a way of classifying texture and objectifying texture. And so it involves, again, levels from 0 to 7, and it goes along a continuum for both liquids and solids. So solids go from 3 to 7. 3 is a liquidized texture, so it's thinner than puree. And then it goes on to puree. So a 3 is liquidized, a 4 is puree, a 5 is minced and moist, and then there is bite-sized, which is 6, and then regular and soft kind of go together, and that's 7. And then there's a similar guideline for how we quantify the thickness of the liquid. So the least restrictive would just be thin liquids, and then that would be a 0. And then it goes all the way up to the thickest liquid, which is an extremely thick liquid. So again, it's a way to have a number provide real meaning as to what patients should be eating and drinking. And so for you patients, it absolutely, who needs to know it more than you? So I feel like now hopefully we have new ambassadors and advocates for this program. And I really hope that you will take this and go back to your providers and say, hey, this is important stuff. And you know what? This is how change happens. And I think it's fantastic that you're interested and engaged. And I do believe that slowly this trend will gain some traction along the broader head and neck community and dysphagia community. Because remember, this isn't just for head and neck cancer, this is for all types of dysphagia.
Fantastic. We're running right up to the hour. There are a couple of last questions I'm going to ask here. One question is about insurance. My medical insurance doesn't cover a nutritionist. Is an oncology nutritionist covers by anybody's insurance, or is there some way to work around this? I don't know, Lisa, if you have any words of wisdom there.
That's a good question. And unfortunately, a lot of insurance does not cover the cancer dietitian. In our facility, we're lucky. I am free to all of our cancer patients because I'm supported that way here. I would ask at your institution, and it may be also that they are included, the service line is included in your cancer treatments and they can set an appointment, but just asking, calling your individual insurance companies and asking if you do have coverage that way. Medicare does not cover medical nutrition therapy for cancer patients. It's something that we are lobbying heavily to get this included in new legislation. And it's been a thorn in our side for a lot of years.
Fantastic. All right. Well, we're running right at time here. And I would like to once again thank all of the survivors and caregivers who have joined us today for this webinar. I would like to give a special thanks to our panelists, Ellen Sheffer, Lisa Macaroni, Lisa Blumenfeld, and Rachel Sachs, as well as the Head and Neck Cancer Alliance and the American Head and Neck Society for their time in organizing and hosting this webinar. I also want to thank our sponsors, GSK and Merck, for their support as well. We hope you all will consider joining us tomorrow for our live Twitter chat session on this subject. It will be held from 4:30 to 5:30 p.m. Eastern time. There will be a member of the Head and Neck Cancer Alliance staff who will provide the hashtag to participate in the chat session. That is hashtag #AskHNCA. And we hope you will join us to ask any additional questions or provide any additional tips that you may have. Wishing you all a very happy holiday season, and we hope to see you tomorrow.